Hello, and welcome to the Patient Education Series about diabetes medications. My name is Tamara Shrianot, and I am working on behalf of Dr. Wasim Huck at North Texas Diabetes and Endocrinology in Flower Mound, Texas, and Close Care. Today, we will be discussing a class of medications known as DPP4 inhibitors, which includes Januvia, Onglyza, Nesina, and Tradjenta. If you have been prescribed one of these agents, we hope this video helps you better understand how this medication works, any potential side effects, and what its role is in managing your diabetes. What are DPP4 inhibitors and how do they work? In simple terms, DPP4 inhibitors are tablets that lower blood glucose levels by increasing insulin release from the pancreas in response to eating a meal. The specific mechanism involves the prevention of breakdown of a hormone called GLP-1, which promotes insulin release from the pancreas. The DPP4 inhibitors block the activity of the enzyme DPP4, thereby allowing GLP-1 to remain in the body longer than usual. Increased activity of this GLP-1 hormone results in more insulin release from the pancreas in a glucose-dependent manner. These medications help to reduce the A1C by 0.6 to 0.8% over 6 months of treatment. DPP4 inhibitors are also weight neutral. DPP4 inhibitors are available in the following doses: Januvia in 25 mg, 50 mg, and 100 mg tablets, and Onglyza in 2.5 mg and 5 mg tablets. Other available doses include Tradjenta 5 mg and Nesina 6.25 mg, 12.5 mg, and 25 mg. DPP4 inhibitor medications are also available in combinations with other medications, such as Kazano, which is Nesina combined with metformin, Gentadueto, or Gentadueto XR, which is Tradjenta with metformin or metformin XR. Janumet or Janumet XR combines Januvia with either metformin or metformin extended release. Qtern, which combines Onglyza with Farxiga, and Glixambi, which combines Tradjenta with Jardiance. Other combinations are listed below. When should you take your medication and when should the dose be increased? In general, DPP4 inhibitors are taken once daily in the morning with or without food. The healthcare providers will generally determine when the dose needs to be increased after 6 weeks with review of the patient's home blood glucose monitoring log. They may also review the 3-month average based on the hemoglobin A1C. If you are on a combination pill, you may need to take the medications twice daily as directed by your healthcare provider. What are the side effects? Well, these agents are generally very well tolerated with minimal side effects. Adverse events occur in less than 10% of people. However, sometimes side effects may occur. They may include flu-like symptoms such as a runny nose, headache, or upper respiratory tract infections, or gastrointestinal problems such as nausea, diarrhea, or abdominal pain. Joint pain is another possible side effect. The dose must also be adjusted in most of the DPP4 inhibitor medications depending on renal function. A very rare potential side effect of DPP4 inhibitors includes acute pancreatitis. The incidence of this is very low. However, please be sure to inform your healthcare provider if you experience extreme abdominal pain and vomiting while taking one of these medications. There is also an increased risk for heart failure, but this is only associated with the Onglyza and Nesina medications. Patients should also inform their healthcare provider if they experience shortness of breath or swelling, as these may be signs of a serious adverse event. The patients who should not take a DPP4 inhibitor medication Include those who have had a bout of pancreatitis in the past. Consideration for an alternate therapy should be also taken in those with independent risk factors for developing pancreatitis, such as elevated triglycerides and alcohol or tobacco use. In some cases, a history of heart failure can be a contraindication to taking DPP-4 inhibitors, especially with Nesina and Onglyza. Be sure to avoid drinking alcohol with these medications due to the potential for the precipitation of acute pancreatitis. In conclusion, DPP-4 inhibitors are a class of medications best known for being well tolerated with low risk of side effects, low incidence of hypoglycemia, and weight neutrality. They truly have a unique spot in the management of your diabetes. Please again remember that this video is to be used for informational purposes only and not to be used as a substitute for consultation with your healthcare provider. Please reach out to your healthcare provider with any questions you have regarding your unique medical management. Thank you again for joining us, and good luck.